Hemolatical disease, jaundice in the first 24 hours of age, blood group incompatibility A1, ABO, reacid less common, Cal and Duffy, red cells enzyme deficiency, red blood cells membrane defect, positive family history, species poor intake reduce hepatic functions and increase the AHC, impact to rule out eating well, breathing well's case in a sepsis can be affected. Non-hemolytic jaundice increase the unconjugated bilirubin level. Normal percentage of reticulitis. Psychological jaundice, the most common extravascular sources like a cephalic hematoma, polycythemia, hemorrhagic exaggerated enterohepatic circulation, decrease the bilirubin consumption. Psychological jaundice not a true anymore. Cerebral Naegeli syndrome's absence of congestions only cure is a transplant. Hypothyroidism will be jaundice until give a thyroxine breast milk jaundice. Term infant born VSD developed jaundice at 24 age. What is the most likely case of jaundice? Cause scenario: six-week male infant with a prolonged NG started on a 4-day or live, but it continues and it has the coracoid fascia features. Umbilical hernia, protruding tongue, shallow breathing, low cry. What is your diagnosis? Hypothyroidism. How do you manage this? In fact, just give a thyroxine. Impaired bilirubin excretion. Direct hyperbilirubinemia obstructions happens. Conjugated bilirubin levels of total serum bilirubin levels, baby passing dark urines and pale stools, biliary atresia and obstructions, infections, metabolic disorder, chromosomal abnormality, important to catch early and treat early. What is test? What is the indication? Term male newborn presented on the second day of life with a jaundice, otherwise normal baby look well physiological. What further question do you want to obtain? Everything will be a normal, probably will have family HX of sibling with a neonatal jaundice with the only required further therapy. Clinical signs you want to elect, how do you manage such neonatal conservative therapy or phototherapy? The level of bilirubins exceed a certain level. In fact, with a multiple risk factor may develop an exaggerated form of psychological jaundice in which a total serum bilirubin level may rise as high 70 mg per dls. What is the commonest case of non-hemolitical hyperbilirubinemia in a healthy neonates? Physiological jaundice. Which one of following is not included in criteria for psychological jaundice? Onset with 24 hours notice. Physiological rate of TSB in treatment is 5 mg. Level of TSB reaching a 20 mg. TSB is mainly indirect non-conjugated. Criteria for psychological jaundice: onset 24 hours of birth, rate of TSB treatment, level of TSB, types of bili, indirect duration less than 2 weeks in a terms and 3 weeks in a preterm neonates. Jaundice and breastfeeding. Early onset breastfeeding associated jaundice or breastfeeding failure. Breast milk jaundice occurs late in a newborn's period, usually peaking in a 6 to 4 days of life. This materials in a breast milk that interferes with the conjection is so far unknown. It occurred later when the baby ingests enough breast milk. Pathological jaundice. All etiological of jaundice beyond physiological